I'd like to talk about burning and tingling in the hands and feet of Lyme disease patient. This is part of a Common Sense Lyme Pain series. I'm Dr. Daniel Cameron. So let's begin. The symptoms often include burning and tingling, pins and needles. It can be hands and feet, sometimes the face. Oftentimes it's one side more than another. It can be like left arm, left leg. Can't even affect the face on the same side as the extremities. It can be worse at night, but I've seen patients have it all day long, may feel like electrical shocks, and often they have the symptoms, but there's no clear diagnosis that has been established. Now, small fiber neuropathy is one particular type where it requires a biopsy or specialized testing to prove it. Small fiber neuropathy is a sensory issue. Also, it can affect the autonomic nervous system. I see it in Lyme disease, also in diabetes and multiple sclerosis. Commonly, the numbs and tingling in the hands and feet in Lyme disease patients has been mistakenly called diabetic neuropathy. Even in patients who don't have any history of diabetes, sometimes it's called multiple sclerosis, anxiety or stress, or there's nothing wrong. So what you should look out for is burning feet at night, although I would often argue that it can be almost any time. It can be tingling at rest. It doesn't always make sense where it's tingling. But at the same time, there's often other issues like autonomic problems, including sensitivity to light touch, which they call allodynia. The labs are commonly normal. Even if you do a biopsy of the leg, often it's normal. Thank you for joining me. Subscribe if you haven't already done so. Comment if there's any symptom you're struggling to explain. And follow along as we dive into 90 types of Lyme pain, one video at a time.